large as Florida is, it feels often like a small community. So truly, it's been just an incredible experience.
So how have the summers been for you?
I know a lot of people think that coming from Maine, that it was going to be a problem. I like the heat.
Okay.
I actually like the humidity. So I know. But yeah, no, I'm surviving just fine. I'm not, as I've shared with so many, I heated my house entirely with wood in Maine. I am not missing the 10 below mornings out in my woodshed. I know it sounds like pioneer days. Truly, Mainers love to try to avoid turning on their furnace until they absolutely have to. So, yeah, I'm not missing that.
Well, that's great. Well, welcome to Florida. Thank you for being here. Thank you for the role that you play. I wanted to start, Secretary, by talking about your background. I know that your mom was in healthcare as a nurse's aide. How did you get into the foray of healthcare?
Well, yeah, it is true. My mother was a nurse's aide. And when I think about those early years, the hospital was a big part of our life because of the hours, the 24/7, the days, the nights, the weekends that my mother worked. But I also remember from an early age understanding workforce challenges in a hospital, because if I needed to be at home from school because I was sick, often they would call my mother and say, "No, Sue, come on in, bring Mary up to the hospital, we'll put her in the nurse's lounge." Well, at the time, they were still smoking in the nurse's lounge, right? So I'd be there with my cold, dealing with whoever was coming in to smoke. Very different times when we think about how, I'd like to say how quickly things change, but that was quite a while ago. But really important part of my youth was the role of that hospital, not just in my family, but in our community. I grew up in a very small community, population of little more than 5,000, and that hospital was a center for many people.
It sounds like for you, it was very formative in terms of launching your career.
Well, it's interesting. I have two boys now, 25 and 20, and I have said to them often, be open to the paths that present themselves to you, right? I was going to have a career in international relations.
Okay? Is that right?
That's what I thought. That was where I was headed in college, and things change. And I think our lives, our careers, they're rarely a straight line. And I got interested and passionate about politics and government at a very young age. My father and I used to debate frequently when I was very young, and he was chair of the local school board, which often can be also the center for many local debates and issues. So I learned from him a lot about that. And then ultimately went to work as a congressional page. So I finished my senior year of high school as a congressional page. So I went to school in the attic of the Library of Congress in Washington, D.C. It's a longer story about how I got on that path. My parents moved from Maine to Arkansas when I was 15. That motivated me to get a little bit more involved in government and politics. I found out about being a congressional page, one of the best experiences, opportunities of my life, to have a front row seat to the United States House of Representatives. I served on the floor, got to see Speaker Tip O'Neill in action. So
that's their history.
Yeah, so that truly helped to shape many of the next steps.
Well, Secretary, we have not talked about this, but I lived in D.C., but more importantly, I lived in Arkansas. My parents live in Little Rock right now, and they teach at the hospital there. How was your time in Arkansas? Did you enjoy it?
When we talk about those things that affected us, now my mother will say those were character building years. Hard to move anywhere at age 15. I'm sure my biggest challenge was I wore that I was from Maine right on my sleeve. Probably not in the best interest of blending in. I practiced dropping my R's at night, but honestly, it taught me a lot about relationships, resiliency. For me, as I said, it motivated me to really look at where I wanted to go, got involved with some of the local opinion leaders who ultimately helped write the letter of recommendation to the local congressman about me serving as a congressional page. So Arkansas opened my eyes to the world, really, right? And to embrace all the diversity in our country.
Well, so I want to explore that with you for a minute. And I want to remind our attendees that are listening, if you have questions, please submit them through the chat. I'll be checking periodically, and we'll have a chance to take those questions. But I want to talk about how you go from international relations and thinking that that's the path to healthcare. So how did that segue go?
Yeah. So I ultimately had a great opportunity, along my career to go to work for the Maine Hospital Association. And that's probably where I really started to delve into healthcare. Obviously, spent 11 years there and had the opportunity to benefit from that experience, that exposure. Certainly helped to shape a lot of my early experience to healthcare. I stepped down from that position after 11 years, and this is one of those things where, I'm not sure I would ever advise one of my sons to do this. I stepped down without really knowing what was next. I knew I wanted to leverage the experience I'd had. I knew I wanted to give back. I wanted to serve, and that parlayed into a opportunity to go to work for a new governor in Maine as his health policy aide. I worked in the federal government, but never at the state level. And, but that was just a short-lived time. He quickly asked me if I would run Maine's Department of Health and Human Services. And that really gave me a perspective about the breadth of healthcare and social service programs, and I'm happy to speak more about that. 6.5 years, I oversaw the Medicaid program, child welfare, the state psychiatric hospitals, public health, all the welfare programs, food stamps, TANF. So amazing to have a chance to lead an organization, had over 3,600 employees, a budget of $3.5 billion. Again, that pales in comparison to here in Florida, but really so many of the same issues. It's scale,
right,
but it's about how do you look across all these government programs? How do you understand what at the end of the day you're trying to drive, right? Who do we serve? How are we serving them? How do we define success and measure our accomplishments against that?
Well, let's talk about the transition to Florida. So, certainly a little bit different than Maine, but a lot of similarities in terms of experiences. So, number one, Secretary, how did the transition come? Stop in D.C., and then how did you make your way down to Florida?
Yeah. So, after I had served as commissioner for 6.5 years in Maine, I then ran for governor. I lost. Again, amazing experience, right? You're standing in somebody's living room who you've just met, and you're talking to their friends, their family, their neighbors about issues of concern to their community, their state, and their country. Incredible opportunity. After I lost, I was asked by the Trump administration if I was interested in coming to work in D.C., serving as the director of Medicaid in Washington, D.C. Obviously, incredible opportunity, one that I was honored to be asked to do. And so then I get a call from the DeSantis transition team. It was shortly after I had arrived in D.C. I was not looking. I certainly have never left a job after such a short period of time. I initially said no. The governor called, very persuasive. And as much as I value the work that is done at the Centers for Medicare and Medicaid Services, having been part of the Trump administration, there is nothing like being at the state level, the opportunity to work for Governor DeSantis, the values and principles that he represents, I feel very strongly about. But then it's really there's a reason why they call states the laboratories of democracy. But in healthcare, to really be able to engage with individuals on the front lines, to speak with chief medical officers and nurses and ER physicians and hospital CEOs and nursing home administrators and frontline caregivers, and understand, where they see all the positives, the work that's being done, where the barriers are, and at the state level, being able to quickly inform policy changes. To me, that's how we can lead and really work to transform the healthcare delivery system. That, of course, is a fundamental difference between state government and the federal government in terms of the pace of change that you can accomplish.
So I want to explore pace of change in Florida in particular, but part of today's series is about lawyers in the healthcare space in Florida thinking about their own careers during this crazy, somewhat unpredictable time. And it sounds like you're involved a fair amount of risk, right? Is moving to a new state that you'd never been. Had you been to Florida before?
I'd been to Florida. I had never been to Tallahassee.
All right,
yeah.
a new city
yeah.
and changing jobs.
Yeah.
What would you tell the lawyers that are listening today about taking risks and where that's gotten you in life?
I think the best thing I have learned is you have to push your comfort zones. It's how we grow. It's how we learn. When I talk about moving into the position of Commissioner of DHHS, I had never had that level of responsibility. I was learning something new every single day. I learned about management. I learned about how to drive change, how to create team, but all of it because I was willing to take the risk. But it was painful, right? I mean, there were days where just putting my feet on the floor was what I had to focus on to jump back in, because in that arena, in a social services arena, there's something going wrong almost every day. And you have to embrace that. You can't run from it. And you have to focus on why you're there, what you're trying to drive, have that those set of principles and priorities. And risks are part of a career path. Yes, I mean, it was a huge risk to move to DC. I'd been in Maine at that point over 20 plus years. When I came to Florida, I mean, I'm sure it would have been great if I kind of kept a journal on that road trip down. But the rearview mirror is a wonderful thing, and I can see, you may not know it at the time, and you may have the reluctance or the concern about, is this the right step? I think, we all benefit from constantly pushing ourselves to embrace the next challenge. What we learn from that, the resiliency it creates, and again, for me, first of all, I think I've probably found some of the friendliest people on the planet here in Tallahassee. This is such a phenomenal community, so I feel very blessed to be here. It has been a phenomenal experience working for Governor DeSantis. This agency plays such a pivotal role in the lives of so many Floridians, and again, I'm humbled to have the opportunity to serve Floridians, to drive change. Now, the last 5 months have absolutely dominated our responsibilities, again, protecting now 21 million individuals and really striving to protect and guard against COVID.
Well, let's jump into that. So we heard a little bit about your life story, a little bit about how you got here, and we're glad you're here. Now let's talk about COVID and how that's been. So when you look back in the past 5 months, the amount of change that is undertaken in Florida and in your job, could you have ever predicted anything like this?
No, I couldn't. And again, I will say, though, that you draw upon what you've learned, and you draw upon your experiences, even though there was no playbook for this, completely unprecedented. You know, I had been in experiences where that are crisis-oriented. So I oversaw the child welfare system in Maine. And one of the things that I learned from that experience is that the people around you, your team, feeds off of your reaction.
Yeah.
And if you behave like everything is a crisis, you're going to get a crisis-oriented response.
Absolutely.
Right, which is not in the best interest of a thoughtful, substantive approach to managing. Doesn't mean that it's not a crisis, but you got to have that calm approach so that you can hear all the information that's being provided. You can be deliberative in the best interest of driving with a sense of urgency the decisions that are needed. That served me well coming into COVID, to be engaged, obviously, with the governor's office across this multi-state agency response. Again, knowing that we didn't have all the data that could inform. We knew fundamentally the greatest risk was to our elderly, to individuals with underlying health conditions. We knew that the risk of rapid transmission existed in our nursing homes, our assisted living facilities, and we also understood that our biggest challenge was ensuring that we had the capacity in our healthcare system to meet the demand. That was our focus. That was certainly my focus here in the agency, the role that I played, continue to play for the governor, making sure that everything we're doing is in support of protecting our most vulnerable, supporting our healthcare system to have the capacity. Now, I will tell you, I also had one other experience, doesn't quite come close to comparing to what we've been through here, but we did have some exposure to Ebola in Maine. Again, longer story, but we did have individuals who were being tested for Ebola. We had a nurse, a rather high-profile situation with a nurse who came back having served patients with Ebola, arrived in Maine, and there were a lot of expectations about what we were going to do to protect the individuals in that state. So again, I think we draw upon all of those experiences to lead. People want leadership, and that was certainly true, has been true here in Florida with COVID. And I will also say this, it comes down to relationships. People ask, you know, what is it about our response in Florida? And I said this earlier, large state, obviously, but we have worked as though it was a small community. The fact that hospital CEOs and chief medical officers and nursing home administrators had my cell phone number and knew that they could talk to me literally 24/7. And that made such a huge difference. I could hear what was occurring in hospitals in Broward, in Miami-Dade, and in Jacksonville, and in Pensacola, and getting on the phone with coalitions of hospitals and nursing homes and county public health officials and emergency management, and participating, not directing, not dictating, but participating and engaging. That made a huge difference, because our response couldn't be this top-down delivery from Tallahassee, but obviously we gave voice to all of the concerns, but we used the feedback to further inform our response.
Well, I want to drill down on a few parts of that answer. And while I do that, though, I want to make sure that those that are participating, if they ask questions, I'll be checking my iPad occasionally to see what our audience has in terms of questions. But you said something very interesting at the end about how this is about relationship-driven and really being able to leverage relationships. Given that you were so new to Florida, or relatively new to Florida, how did you overcome the fact that, you know, you're making relationships as you go?
Right. Well, there's nothing like a crisis to serve as a catalyst for change and for engagement. Now, I want to back up just a little bit too, because since I arrived here, one of the things that I have learned throughout my career is that it's important to get out from behind your desk. And you can't understand what's going on if you're just here in Tallahassee. So I've literally been out on the road since I arrived, going to federally qualified health centers, going to mental health agencies, group homes for individuals with intellectual and developmental disabilities, nursing homes, hospitals, meeting with all sectors of the healthcare continuum to understand what's working, where the barriers are, and through that process, began to quickly develop relationships. So now fast forward, well, let me also say, we've been charting a course here around quality in healthcare and initiating a number of pilots and regional coalitions to talk about individuals who are lacking appropriate access in the community and so are ending up in the emergency department, preventable use of the emergency department. So over the last year, we've had a lot of coalitions meeting, and I've been there. So that was a great foundation.
Pays dividends, absolutely.
That's right.
Yeah.
So I had a lot of these relationships, but there's no doubt that over the last 5 months, I've made many more.
I'm sure you have.
And I needed folks to understand how important it was. They could call me, that they could share their frustrations, their concerns, so that I could both better inform the governor, but better support them, right? This is about public service. It's not about Mary Mayhew, it's about public service and how do I serve? And that guides me every day. And so I'm really pleased that we were able to and have been able to have the breadth of relationships. Those that existed before got strengthened, and then many new relationships.
Well, I'm sorry to be such a lawyer on this one, but I want to talk about your relationships with lawyers. So specifically, the role of lawyers in the system. How have lawyers kind of affected your response, healthcare lawyers, advocates for clients, for example, how have they affected AHCA's response to COVID? So,
you know, we talk about lawyers. I mean, lawyers are an incredible part of the process. You know,
You're nice to say that.
Yeah,
or a frustrating part as well, I guess.
Yeah, no. Listen. This is, I think, really important. You have to have a strong respect for process, a strong respect for the foundation of our democracy in the United States, what it is built upon. You know, people can get frustrated with the legislative process, but it is a critical process that I have an incredible amount of respect for. Well, the same is true for lawyers and the role that they play. No matter how contentious or polarizing, this is what we pride ourselves in. We can't lose sight of that. It's foundational. And I think as things become personal, sometimes we attack the overall system instead of work to improve, right? That it can be done in a respectful way. It doesn't mean that there's less passion. So lawyers interacting, I would expect nothing less. I mean, given the magnitude in this agency in terms of the work that we do, the regulatory structure of 50,000 providers that we regulate, we need to make sure that there's a strong and healthy process. So our regulations that we propose need to have the comments and the engagement of lawyers. You know, every step of the way, every decision that we make, when we talk about accountability in the healthcare delivery system, something that I have been driving and focused on, well, similarly, government obviously needs to be held accountable. Government is not often accused of being nimble, right? And often we can be, you can develop in government a bunker mentality because it is I think for some who are in the private sector, somewhat difficult to understand and appreciate. In government, every decision you make, every communication you issue is subject to freedom of information. Your decisions are often playing out on the front pages of the newspaper and in the evening news, as it should be. And so we need to ensure that there's constant accountability for our actions so that government can be held in check. We serve the public, and that needs to be front and center, and lawyers play a vital role in that accountability and in shaping good policy.
I think, unfortunately, you emboldened all of us on this video today, but thank you for saying that. You know, if you're sitting here watching this and you think, all right, well, lawyers play an important role, they're part of the system, there's an accountability role. In your mind, what really differentiates the extraordinary advocates from the ordinary ones? How does a lawyer watching this video kind of really make a difference when he or she wants to advocate on behalf of an issue before AHCA?
Yeah. So it's probably true whether you're a lawyer or anyone trying to affect change, policy change, payments here in front of this agency or in the legislature. It's presenting a substantive argument. It is knowing the information, understanding the policy, having good data where that's appropriate and relevant. It's having a similar respect for the process. It's easy to get emotional, and again, passion is important, but I think not having that overshadow the substance of the information and the argument. That just comes with experience, right? If I'm screaming all the time, people shut down. They stop hearing you. And so that's true of anyone who's seeking to advocate, that your message isn't lost in the delivery.
And do you get the sense from both your experience here and in Maine that lawyers are actually, the quality of the lawyer can affect the outcome? That it's not just a decision that's already preordained, that really lawyers can play a role in shaping your opinion on issues?
Absolutely.
And that's not just lip service, like you actually...
Oh, absolutely. I mean, that's really important. You know, government, as I said, has to be shaped by the multitude of voices in the public that need to be heard. And so lawyers have a pivotal role to be that voice, to provide the perspective. The government can't know all aspects. We're not perfect. There are human beings here. People have certain opinions, certain experiences, none of which, by the way, this is not meant to be disparaging. We're all human beings. And so that's why we have the process where lawyers can be part of that process, representing the different opinions, that then through that process, better policy is on the other end. Yep.
Well, I mean, it's reassuring, and unfortunately, I think, again, it might have emboldened quite a few of us, myself included, to be part of that process. I want to go back briefly.
Less is more. Can I make that for every lawyer? Less is more.
We'll make sure that's documented. I want to go back briefly to the COVID-related questions. And again, I'll encourage the attendees to submit questions, and Emily Young, our bar liaison, if she can email those to me, I'll make sure that we ask you those as we go. Back to COVID, I'd like to ask you, Secretary, what has been the biggest surprise for you, both positively and negatively? So from a positive perspective, what have you been most surprised about how the state has responded, or how AHCA has responded, or healthcare practitioners?
Yeah, it's hard to say surprised, because I think we were in such uncharted waters. And the rearview mirror, as I said, you know, it can be both painful, but it can also reinforce. You know, the path that you were on was the right one. And I think because we were all learning across the country and throughout the world about COVID, what I hoped going into this, and what has been reinforced throughout, is that Florida has a very strong emergency preparedness foundation. And that can't be overstated. When you have that level of engagement between the state, the county, cities, the officials, the emergency management personnel, and the healthcare providers around the state, that created a great foundation upon which we could build to further our response to COVID. So that, to me, was critical. I think the challenge that we've all faced, well, there's so many, we didn't have great data. And so when you think about in those early weeks and months, it was all about modeling and trying to leverage models from around the country, around the world, to try to predict. We learned very quickly we needed to focus on Florida data. And again, I will say, as part of our preparedness, Florida has had the emergency status system. And, you know, sometimes we get a little desensitized about something that's been around for a while that hospitals and other healthcare providers routinely report into during, in particular, a hurricane. I just can't say enough about how invaluable that emergency status system has been and remains. You know, when other parts of the country didn't know how many ventilators, how many beds were available, how many ICU beds were available, we had that data at our fingertips every single day. So that really has played a critical role in our response, a Florida data-driven response.
I never knew that every September and October when we went through hurricane season, it would make us ready for a pandemic, but
Seriously,
here we are,
right?
And it makes total sense. You know, I think one of the comments that many lawyers would say is that the state was particularly flexible early on with relaxing certain regulations, and I think many of us are appreciative. I'm curious, from your perspective, Secretary, how much of this regulatory flexibility do you think is going to exist even after COVID?
What a great question. Boy, that's a hard one.
Sorry.
It's a difficult one because we need to be careful, right? There's this, as you all know so well, right, co-equal branches of government, and we need to be careful that government doesn't take on roles that disrupt that balance because of an emergency. I'm very sensitive to that, to the role of government, that if it becomes too expansive, you know, the effect that has on civil liberties. We were nimble in response to the emergency. I'm got to get it done, right? We got to get it done, you know, setting up all those dedicated isolation facilities. My team here understood the sense of urgency, and we needed to get it done. Creating pathways for people to access services in the hospital, to receive home health care back at home, reducing the prior authorizations, anything that could serve as a delay, right? We knew the parameters against which we were evaluating changes in our regulations against. We need timely access to care in our hospitals for COVID. We need to be able to provide people with access to all of their services in their homes to reduce the risk of exposure to COVID in their communities. So everything was being evaluated against that. And then certainly some of the other flexibilities around access to healthcare professionals, looking at what surge capacity might look like in our hospitals. How would they convert physical plant space? Always trying to make sure that we were still evaluating it in the context of quality and safety, but being responsive. And that's just, it's really working hard at making sure that government can get out from, when it needs to, that entrenched, more lengthier processes when you've got to respond to the emergency, not carelessly, but that you've got the ability to be nimble. We worked closely, obviously, with the federal government on much of that as well.
Well, let me drill down on this last question, and maybe we'll start segueing towards the conclusion. When you mentioned about working with the federal government, can you talk a bit about coordination with the federal government? How much of our response here in Florida has been shaped by what we see on the ground, and how much of that is shaped by a national response?
I would say a lot of our response was based on our perspective of what needed to be done. The governor was focused on our data. I had concerns, frankly, with some of what we were seeing initially from CMS, from CDC, that, and I'll give you a great example. We understand how important N95 masks are in reducing the spread of COVID. But you saw a lot of confusing messaging coming from the federal government because of a concern about supply. Now, obviously, we wanted to make sure that our frontline healthcare professionals had masks. The concern I had is I didn't want to see the bar lowered in terms of what the right infection control, personal protective equipment needed to be because of supply concerns, especially as we were looking at our nursing homes, our assisted living facilities. Those are areas where they didn't actually have that strong supply chain established to get access to PPE. So we really were making sure that the decisions that were being made here were being informed by Florida's data, Florida's experience, the governor's engagement around the state. Now, obviously, a lot of expertise in Washington too, so I don't want to have anyone misconstrue incredible value in what was being learned across the country and around the world through the CDC, through CMS. But ultimately, we were responsible for Florida, and the governor felt very strongly that this wasn't going to be some robotic, just implementation of what was coming down the pipe. We needed to make sure that this was a Florida-based response.
Well, that's great that we're being reactive to what we actually see on the ground and what's actually happening on the ground. To kind of near towards the end of the hour, so again, if folks have questions, time flies when you're having fun, I suppose.
We haven't even gone back into my childhood at all. I mean, there's just so much more to talk about.
Well, I do want to talk to you about more broadly outside of COVID, about your priorities here at AHCA. When you came in, you emphasized and you prioritized patients being kind of at the center of making decisions that affect them. And how much has your kind of core mission of what you wanted to accomplish, how much has it been derailed or just been put on the side by COVID? And how much do you kind of foresee over the next few years you being able to continue to advance those missions?
Well, first, just to talk about my priorities, Governor DeSantis's priorities. So this is an agency with a $30 billion a year budget, serving now over 4 million Floridians in the Medicaid program, and of course regulating over 50,000 providers, tens of millions of individuals interacting with those providers. So there's a lot at stake, and there is an expansive mission at this agency. The challenge often in government is an attempt to try to be all things to all people, and then we dilute the effectiveness of our mission. My job, my goal on behalf of Governor DeSantis has been to really drive the intensity of focus around quality. At the end of the day, for the $30 billion being spent, for the 4 million individuals being served on Medicaid, can we demonstrate value? Can we truly point to improved outcomes? For the 28-year-old with schizophrenia, are they in a revolving door of the emergency department or the psychiatric hospital? For the 45-year-old with Down syndrome, are his needs being effectively supported in the community? Do his 85-year-old parents have peace of mind that the state is going to support their son when they're no longer able to or no longer around? The 9-year-old with asthma, is she able to get into a primary care practice and have her asthma effectively managed. These are basic, evidence-based standards, basic expectations of our healthcare system, and certainly of a safety net program. But I will say this, I'm very frustrated about where we are with the Medicaid program here and around the country. Medicaid is often a crisis-oriented program, particularly because of challenges with budgets. It has not been as data-driven in driving quality by aligning the incentives. Now, obviously, Florida has managed care, but even with managed care, even in the commercial health insurance market, it is still largely a volume-driven payment structure. The more you do, the more you get paid. And it's also one that responds to the crisis or the acuity of the episode. And it hasn't invested in the community-based infrastructure, the lower cost services that can have much longer term benefit. That's where states have got to really aggressively transform their Medicaid programs. Mental health, we have got to create, with a sense of urgency, reforms in our mental health, our substance use disorder treatment approaches to improve outcomes. That is where Medicaid, we are the dominant payer for mental health services and substance use disorder treatment, but it is not where it needs to be in driving evidence-based protocols. That's where I have just a sense of urgency. We've come a long way. COVID obviously derailed some of that, but here's the real positive. Here's the one silver lining. There are likely others. One silver lining from COVID. It has been a catalyst for telehealth. We have seen dramatic increases in both the providers who are using telehealth and the individuals who are accessing their care through telehealth. So what I have been talking about with the managed care plans, with providers, is how do we sustain this once the crisis is gone? Now, we also want to make sure that what's being received is high quality through that avenue. But when you think about one of the biggest challenges in Medicaid, one of the biggest barriers is access to transportation. To the extent that we can truly support telehealth, with high quality service being delivered, and that can't replace every in-person visit that's needed, but there's some great potential and opportunity there.
I want to just drill down on that for a second. You spoke earlier about the role of lawyers. You talked about how government has to be nimble. It has to be understanding that there's others out there that have knowledge and that can contribute to the system. And then when you talk about empirical-based, value-driven outcomes, there's only so much that the government can do, right? I mean, there's a big private role. It's a role that's outside of your control. How do your sense of urgency to get us to focus on what matters about outcomes quality, how do you do that, given that government is only one small piece of a much bigger picture?
Well, there's two things. One, it's getting information out there, which we have been working on, and it's about not getting so much information out there that people are overwhelmed or paralyzed by it. There's a big debate nationally about the number of quality measures and metrics that are being collected, the administrative burden that's created on providers, that it has in fact detracted from the opportunity to have that laser beam focus on a handful of measures that, if we saw improvements from, would be transformative to the system. So my focus has been on driving those measures, building consensus around the state. We know that if you have diabetes and you're routinely being admitted to the hospital, it's an indication that your needs are not being effectively met in your primary care practice, right? Some of this is not rocket science. It's not like COVID, right, where we didn't have the playbook. When we talk about chronic disease management protocols, they've been around for decades, and we're still not getting the adherence. So part of my job is raising the volume and the awareness and the focus on those measures, but then it comes back to aligning incentives. Am I getting paid when I hire the nurse care manager, the dietitian, the case manager, someone who's looking at the social determinants of my patient panel. If my reimbursement isn't accounting for those costs,
Absolutely.
am I going to be incentivized to support what is a much more expansive team in my practice, probably will help to support producing those better outcomes, but if I'm still getting the same approach to my payment. So that's been my other drive. How do we drive value-based purchasing? How do we incentivize accountable care organizations, accountable communities from a Medicaid perspective, creating more of an integrated approach across the continuum? When you think about what Medicare has done, and they started more than now 20 years ago,
That's right.
with the National Quality Forum and evidence-based measures, and they started with just transparency, getting information out there. They focused on just a handful, right? If you show up in the ER and you're having a heart attack, you need to get an aspirin. And then they held hospitals accountable for that. And then on readmissions, you know, they spent years working through their quality improvement organizations with hospitals, looking at data, understanding what some of the strategies are to prevent readmissions, making sure when the person is discharged that they've got an appointment with their primary care physician or that the home care has been arranged. And then they started tying payment to readmission rates. Now, Medicare is the 800-pound gorilla. So we need to look at, from a Medicaid perspective, how do we leverage what Medicare is driving, and then where are the areas where they're not as focused? Maternal health, right? Newborns. I'm a big believer that our job, my work, is not just within this agency. I work very closely with the Department of Children and Families with Secretary Popple. I'm looking at this young family. How do we help create that path initially through good health that allows them to be successful in school when they enter kindergarten and all the way through school, and then to become strong, independent adults? And it's certainly connected to the work that we do here, our engagement with the Department of Children and Families. So I do think government has a very strong role to play, but we've got to make sure that we're focused on that core mission of driving quality.
I think that's great. I think many folks listening will be so heartened to hear about your integrated, holistic view, but also driving incentives to match what we ultimately want. In the last few minutes, I'll take one audience question that I got, and I'll also ask you one final question, if you don't mind.
Sure.
The audience
What
question.
am I going to say? No?
The audience question is about elective surgeries and about what the future might hold for COVID. There was a ban earlier on elective procedures, and now it's been lifted. Are you able to comment at all on what you think might happen if there's a surge?
I am. I think the governor, it goes back to our conversation about responding based on what Florida was experiencing. And in those early weeks and the fear of this unknown surge that could be around the corner, the country, driven by the conversation at the federal level, began to restrict electives. Now, the governor has said repeatedly he regrets how early that was done because of the impact it had on the healthcare system and people's access to critical healthcare services. Now, it was done because of the limited supply of PPE, the concern about capacity that was needed. Obviously, quickly allowed hospitals and ambulatory surgical centers to resume electives. And then as we began to see the true surge in June and then peaking in July, the governor stayed firm with he was not going to go out and do certainly an across-the-board restriction on electives, but didn't even look at it from a regional. He trusted these hospitals, especially given we had more PPE. We had established a lot in terms of our engagement with our healthcare systems around the state. We learned more about COVID. So they were able to make those decisions. And then I have been on calls with the hospital CEOs in Miami-Dade and Broward and Palm Beach, many of the Palm Beach CEOs, every other day for months. So being able to hear their analysis of electives, and they all implemented it based on their surge plans. And that's true in Hillsborough and Pinellas and Orange and all of the areas. As they started to see pressure build, they knew based on their surge planning how best to start those restrictions. So I'm optimistic that, you know, we've created, even though emergency preparedness has been baked into our hospitals. When you think about 9/11 and all of the money that has been invested across the country in our emergency preparedness, hospitals have been drilling and training, and that's certainly true of other systems. So they've got well-established processes for surge planning. We've learned a lot over this pandemic that I think will inform us even more to the extent that we see a future surge. The hospitals are ready.
Yeah, well, that's great. That's comforting. Final question for you, Secretary, and again, thank you for your time. You know, whenever I have an opportunity to meet kind of great people and great leaders, I always want to ask them about the great influences in their life. So when you make these tough decisions that affect, you know, 21 million Floridians or $30 billion, who do you lean on for counsel? Who are your kind of influences that are helping you get through all of this?
You know, it's so many people that I can think of. You know, it's really important that I go back to, you know, my father was a huge influence in my life for so many. You know, he loved the fact that I would ask him questions. You know, my sisters didn't, by the way. We every summer drove from Maine to Arkansas. My mother was from Arkansas.
Right.
That was a long car ride.
Sounds like
and
it.
I was the youngest of four. And my father believed in just kind of driving straight through. And so I would ask questions from the moment we left Maine till we arrived in Arkansas. That has served me well, because so much of what we have to do is ask good questions, right? Get good information. You get good information by asking good questions. Now, my father passed away when I was 19, but that influence has served me well. I'd say the other important part of any good leader is having a really great team. And it's not a team that all thinks the same way, right? It's a team with different personalities, different opinions that have an opportunity to express those different personalities and opinions so that you're able to inform good decision-making that isn't lopsided. That has been really important. I've been in meeting rooms with the dominant personality and people shut down. You got to be in the room. You have to understand body language and facial expressions. And as a leader, you've got to cultivate an openness that people are comfortable raising concerns, expressing opinions, so that you get the best possible decisions out of that.
That's great. Well, Secretary Mayhew, on behalf of the Florida Bar Health Law Section, about 1,000 lawyers across the state, thank you so much for spending an hour of your day with us today.
My pleasure.
We really, really appreciate it.
Thank you. Thank you for having me.
Thank you.